Communicating effectively with microbiology labs is crucial for ensuring accurate diagnosis and appropriate treatment. Here's a structured approach using the SBAR framework, tailored for an FI2 doctor. Example script for communicating with microbiology labs. 1. Suspected sepsis. Situation. Hello, this is Dr. Taylor, an FI2 doctor from Ward 3. I'm calling about a patient, Mr. John Smith, who is suspected to have sepsis. Background. Mr. Smith is a 68-year-old male admitted 3 days ago with community-acquired pneumonia. He has a history of COPD and diabetes. He has been on 4 antibiotics, but his condition has deteriorated. Assessment. His temperature is 39.5 degrees Celsius. Blood pressure is 85/50ths. Heart rate is 120, and he is tachypneic with a respiratory rate of 30. His white cell count is elevated, and his CRP is 200. Blood cultures were taken 2 hours ago, and we are awaiting results. Recommendation. I recommend we discuss the current antibiotic regimen and consider any additional tests or changes in treatment. Could you advise on the next steps and whether we should start any new antibiotics while waiting for culture results? 2. Persistent infection. Situation. Hi, this is Dr. Patel, an FI2 doctor from the surgical ward. I'm calling about Mrs. Jane Doe, a 75-year-old patient with a persistent post-operative infection. Background. Mrs. Doe had a hip replacement surgery 5 days ago and has been on 4 antibiotics since then. Despite this, she continues to have a fever and signs of infection at the surgical site. Assessment. 1. Her temperature is 38.8 degrees Celsius, and there is redness and swelling around the incision. Her white cell count remains elevated. We have taken wound swabs and blood cultures, but the infection persists. Recommendation. I recommend we review her current antibiotic therapy and consider any additional investigations or changes in treatment. Could you provide guidance on the best course of action? 3. Unusual pathogen. Situation. Hello, this is Dr. Lee, an FI2 doctor from the emergency department. I'm calling about Mr. Michael Brown, a 45-year-old patient with an unusual infection. Background. Mr. Brown presented with a severe skin infection that has not responded to standard antibiotics. He has no significant past medical history and no recent travel. Assessment. The infection site is erythematous and painful, with some necrotic tissue. Initial cultures have grown an unusual pathogen, and we need further identification and sensitivity testing. Recommendation. I recommend we discuss the findings and determine the most appropriate antibiotic therapy. Could you assist with identifying the pathogen and advising on treatment options? 4. Antibiotic stewardship. Situation. Hi, this is Dr. Evans, an FI2 doctor from Ward 5. I'm calling about Mrs. Sarah Green, a 60-year-old patient who has been on broad-spectrum antibiotics for a week. Background. Mrs. Green was admitted with a severe urinary tract infection and has been on 4 antibiotics. She is now clinically stable, and we are considering de-escalation of her antibiotic therapy. Assessment. 2. Her latest blood tests show normalization of inflammatory markers, and she is afebrile. Urine cultures have identified E. coli sensitive to narrower spectrum antibiotics. Recommendation. I recommend we review her antibiotic regimen and consider switching to oral antibiotics. Could you provide advice on the best options for de-escalation?